What's up, friends and family, or family? It is Logan, and this is 7 months update for you. Let's see. Well, today I had to give myself a shot with a lower dose. We had to go back down because I did blood work to check up on how everything's going, and sorry, I have allergies, so it's kind of affecting me right now. Um, anyway, blood test, yeah. So we had to do that because they wanted to check everything was all right, and it turns out that I guess my liver functions had increased, so they wanted to check to see if I had anything other than that, like the tea that was affecting it. So they had to do another blood test after that, but everything checked out fine. So they wound up lowering my dosage. So instead of the 75 milligrams, I'm down back to my original 50. Which, I mean, I'm kind of like a little bummed about it, but at the same time, whatever's good for my body at this point, I can't really complain because things have been going pretty well as far as me, you know, being happy about my physical changes so far. And on to that, I will talk about that now. I've noticed more so now than anything how my body has truly changed. I definitely, I mean, obviously we know about the hair gain. It's not like really like here or on my butt, thankfully. Because as I said before, I don't think I'm gonna be a very hairy guy. But my forearms are definitely bigger than they used to be. There's more muscle tone on them. My chest has definitely decreased in size as far as the breast tissue has gone. Um, and it's like it's crazy because you don't really notice these changes until like like lots of time have gone by, and then one day you just look in the mirror and you're just like, holy crap, this has changed. This is different, and then you start, or if you're like me, I do a little dance because I get really excited and happy about it. But yeah, the chest has definitely decreased in size, and I mean I'm not even wearing my binder right now, and I'm comfortable and I feel more better than like knowing that they have decreased because I mean who knows when top surgery is going to be a possibility for me at this point. Um, but it will happen. It will happen. Hopefully within the next year. um, Same with the fat redistribution throughout my body. Love handles are still slightly there, but it is nothing in comparison to how it used to be at all. At all. And I'm so happy about that. So, I mean, I think for that to truly change, for that part, I'm gonna have to do some serious workout exercises for that because that's just something that my body's gonna need help with, and I know that. Let's see. Um, I fit way more comfortably and how I want to into my clothes. Um, I know that before being on hormones, like I loved my clothes, but they just didn't look on me how I wanted them to look with with the way my body was. And now that I'm on hormones and everything, it just they fit way better and it makes me happier, that's for sure. And it's a great feeling. Um, Facial structure is definitely becoming more and more defined as weeks go by. um, Although I do have my days sometimes where I'm like, man, I feel kind of fat today, and then other days I'm like, damn, I look not too bad, I look pretty good. Um, and I feel like, and I don't know if anybody else talks about this, but I feel like on the days of the month that my body would normally be having its menstrual thing going on, instead of that, I still kind of feel like a little bloated-ish, kind of, and like kind of chunky. I don't know. Like, and then I feel like I look a little fatter too. So it's just like I feel like now instead of getting that part that we all don't like, that that's what the other effect is now, is that I just kind of have my fat days, which is alright. Which is alright. Um, Being out in public now, I'm starting to feel more comfortable with being out and about, and yeah, I don't know. I definitely pass now, like 98% of the time. There's 98, 99% of the time. Um, and I'm okay with that. It's just bothering me less and less because I'm so much more comfortable with myself that it doesn't really bother me when someone calls me a she or whatever. And because I've, like I've kind of mentioned before with the whole being androgynous thing, like I'm just more comfortable with myself now, and I'm okay with that. And I'm definitely coming to realize that I'm not completely identifying as someone who's just 100% male, because that's not the case. I don't really truly believe in gender to begin with. I think it's something we all kind of just have made up and go by in our society for the sake of, markets and, corporations making money and whatever. But, like, I'm just me. That's how I'm going to put it. I'm just me, and that's how I am. And I'm a Logan. And I like being a Logan. No, I love being a Logan, and it's great. I decided to do my video outside today because it's, like, really nice out. And I'm drinking tea, and I love tea. But, yeah. And I like being able to go out dancing now and feeling better and more comfortable, and then being identified immediately as who I want to, be seen as. And it's just nice. It's a really nice feeling to just be in this state of comfort, and it's just nice for once, I don't know. I don't know what else to say. I'm just in a really good state right now, a really good sense of comfort with myself. Still no love life or anything like that going on, and I'm okay with that. I mean, it's officially been past 3 years since I've been with my ex, and it needed to be that way because I needed to find myself obviously first, and I have found myself now, or more so started finding myself within the past 2 years, and it's just getting better from there. So I'm okay with that. It's been me time. Gets a little lonely, I get that, but whatever, man. Whatever. And yeah. Oh, and I've gotten questions from people out in the public and from friends regarding to, okay, after you get top surgery, when you get top surgery, are you going to get surgery down there? Are you going to become a man? And I don't really like how that's being said or whatever, because I don't think, genitalia should have anything to do with gender and being seen as a true male regarding the penis, because whatever. But so far, my answer is no. I have no plans whatsoever of getting bottom surgery. It's a lot of money, which I don't think a lot of people know, because when I tell them that, they get shocked. It's a lot of freaking money. It's close to like 100 grand. Not really covered by insurances, or like at least not by a lot of them. And it's a lot of time to take into doing that, and it's a lot of time to heal, because if the one that I would do would be phalloplasty if I could, and that's like a four procedure like kind of surgery. It's huge. There's like 4 different steps to it, and then you gotta heal between then, and that's a lot of time off that you'd have to take from work, and I don't even have that kind of stability now financially to be able to do that, so there's just no way. And not only that, but your sensitivity when you have sex and everything is not guaranteed. And no, thank you. I'd rather have what I have and be able to feel sensation and have sensitivity and everything and be able to get off, versus not knowing if that's a possibility. I am not. Nope. I'm all set. For now, I'm good. Just want to get rid of that, and I'll be good to go. And I also wanted to talk about and mention about how, I don't know how anybody else feels, but I don't really like when people take it upon themselves in the public, when they're talking to other people, if I get brought up in a conversation or whatever, oh yeah, and then they'll be like, and he's trans, or can you believe that was a girl? And I'm just like, that's not really your business to say to anybody, because it's my business. It's me. Like, who are you to go and do that? Like, I understand some friends do that without realizing it, but I don't want to be identified as your trans friend Logan. I want to just be Logan, your friend Logan. That's it. You don't even have to go into it, because then when you say that, the first thing people think about is what's down there. What's going on with my body? It's no longer I'm being seen for me, I'm being seen as what the hell's in between my legs. And I that just really makes me uncomfortable, and I think that's one of the few things now that makes me kind of angry, to be honest with you, because it's just not your place. It's not your business. They don't need to know. So for anybody watching this, when you talk about your friends, ask them first, how they would feel. And I know for me, it's just not your business. So for my friends that know me personally in my life, when you talk about me, if I become something that we're talking about in conversation to somebody or whatever, please do not release that information, because it is no one's business. Because like I said, that's the first thing they're going to think about is what's down there. However way they see me is how they see me. But obviously they're going to know I'm a dude by how you're saying Logan, he, him. So that's all they need to know. That's really all they need to know. I'm your dude friend Logan, or I'm your friend Logan. That's all that is need to be said. That is the most important thing I really wanted to say in this video today, because it's been kind of bothering me lately, because I know it's been coming more and more of a thing with friends. It's just, I just want you guys to know, don't talk about it. Don't talk about it. No, it doesn't even need to be discussed. Just your friend Logan. That is it. Good? Alright. Awesome. Thank you. With that being said, it will actually be 8 months in a couple weeks, on the 9th of May. And holy crap, it's gonna be May. All I could think of at that moment was the memes with Justin Timberlake. It's gonna be May. But yeah, having a nice day outside. It's my day off. I'm gonna go enjoy it now. So that was my update, and I love you guys, and thank you as always for watching. Deuces.